Thank you. I'm afraid I'm going to have to speak in English. My Slovak is not up to the occasion. So, healthcare systems around the world are suffering from backlogs caused by an increasing demand driven by aging populations. These are some of the numbers for the United Kingdom, but I'm sure that the problem is the same in Slovakia as it is elsewhere. The numbers of appointments are just huge. So there's a drive to try and move healthcare out of hospitals and closer to the patients. And our mission at Éclateral is to take that all the way into the patient's home. There are two benefits to doing this, as well as reducing the burdens on the healthcare systems and increasing better outcomes for patients. There's also social drivers for trying to minimize the amount of travel that patients have to do to get to those appointments. In the interest of time, I'm just skipping over some of these, but the recent election in the United Kingdom, which changed the government there, the government now has a drive to move care rightwards, is what they're talking about. So that's hospital to home, treatment to prevention, and there's a third, which is also relevant. The way that we're addressing the problem is by making clinical grade tests that cost as little as a lateral flow test. So during the pandemic, we were all taking lateral flow tests to try and track the disease, and we were fortunate to receive funding from the UK government, which we're very grateful, to develop a COVID test. The advantage to the UK government of our test was that every test taken is reported if it's a digitally connected test. The way that we make the test digitally connected is that we use we use a lateral flow test that is electrically connected through a reader that is pocket-sized. It's smaller than my hand. The reader uses Bluetooth to communicate with the phone, and the phone can push the result straight to the clinician, even if the test is being taken in the patient's home. I won't go into the details of how all this works. We have a booth outside, which you're welcome to come and learn about the technical detail. The first test that we're rolling out is a test for the most tested protein in medicine. Sorry for so many tests in that sentence. The most tested protein that is most tested for in medicine is C-reactive protein, CRP. And the intended use for our first test is to reduce the use of antibiotics by triaging between viral and bacterial infections. CRP is already part of the clinical pathways in the United Kingdom. There have been more than 12 clinical trials showing that CRP testing can be used to reduce antibiotic prescriptions, and this is the pathway that we're following. We plan to have that test launched in the second half of 2025. We'd be delighted to talk to anybody in Slovakia who's interested in this. We think the test can be used in a number of settings, including pharmacies and care homes, as well as in patients' homes. We then aim to build on this, what we hope is going to be the success of that test, by launching a range of women's health tests, starting with a test for the menopause that will be launched in 2026. And again, allowing women at home to take control of their own, to understand what is happening as they're going through that time at home, I think will change lives for half the human population. Yes, I think I've said all of this, and because we only have 5 minutes, I'm not going to talk about it more, but there are opportunities for us to partner with people who are interested in big data, because we can enrich your data sets by opening a window into the patient's body. So it's no longer just about using a fertility app to track one's fertility, or using a wearable like a ring or a watch. You can now open a window into the body, and we're interested again in talking to anybody with AI-type solutions who are interested in using our data. So that's my summary. I've got 40 seconds left. We've taken lateral flow tests, which are very low cost. We've maintained those low costs, so the cost to the user of our tests is less than €2. The cost of our reader is less than €30, so it's a very accessible system. With an electrochemical measurement, lateral flow tests become fully quantifiable. They're completely objective because the patient can't see the data. the clinician stays in control of the result and of the test. They're also more sensitive, and there's less than a 10% increase in the cost of manufacture. Thank you.
Thank you very much. Thank you, Mr. Ko Ferrigno.